Health effects of mercury in fish. The current federal dietary guidelines are that most fats should come from sources of polyunsaturated and monounsaturated fatty acids, such as nuts, vegetable oils, and fish, a significant component of the Mediterranean diet. However, all fish have methyl mercury, though some have more than others. Here, the Western Pacific Council of Fisheries claims that selenium may counter any effects of mercury, and they may be right, but let's review the evidence. So, what is mercury? Mercury can be produced by coal power plants and found in various electrical equipment and gold mines. It is even found in mercury fillings at the dentist in most of the world. According to the Annual Review of Ecology and Systematics, most surface waters are a source rather than a sink for atmospheric organic mercury. This methylated mercury arises from the methylating bacteria in anoxic or low oxygen waters. About 6% of the population exposures were at or above the reference dose. So the reference dose is a descriptor of the exposure benchmark to indicate acceptable exposure levels without appreciable risks. And these were some figures that shows the total mercury deposition in the land, and you can see it's concentrated in New England and also in the southeast. After doing a national survey for health, NHANES, they found a range of observed concentrations from 0.07 to about 39 parts per billion. And then they found that about 6% of the population had exposures that were above this reference dose. And this reference dose is a descriptor of the exposure benchmark to indicate acceptable exposure levels without appreciable risks. The EPA has set the most stringent reference dose of 0.1 micrograms per kilogram per day. And then WHO is about twice that, and the Agency for Toxic Substances is 3 times that. So setting the bar higher before there's a considerable impact on health. Now, among frequent fish consumers who have had more than 3 fish in the past 30 days in this study had a geometric mean hair mercury level that was 3-fold higher compared to non-consumers. They measured 0.3 parts per million versus 0.11 parts per million, so it's higher in fish consumers. And the higher percentiles of exposure were also reported, with the 95th percentile having hair mercury levels corresponding to 1.73 parts per million for all women and 2.75 for all women consuming fish. In terms of the relationship between maternal mercury body burdens and IQ in children over age 6 from 3 large epidemiological studies, these are the estimated coefficients that indicate the decrease in IQ. For example, 0.12 or 12 points for each part per million of mercury in maternal hair. In some recent epidemiological studies in men, methyl mercury exposure is associated with a higher risk of acute myocardial infarction, coronary heart disease, and cardiovascular disease in some populations, while other studies have not observed this association. There is a possible link between methyl mercury exposure and hypertension and heart variability, but the case is not strong. The Minamata adults from Japan that we'll talk about soon had significantly elevated resting heart rates and a slightly, though not significant, decreased variability in heart rate when compared to controls. However, in a more recent study from about 1,200 women aged 16 to 49 from the NHANES, the National Health and Nutrition Examination Survey, between 1990 and 2000, They showed that no association was observed between total blood mercury and blood pressure in fish consumers when data were stratified by fish intake. More research is required to reduce the uncertainty on cardiovascular effects. So, according to the World Health Organization, mercury exposure can have an impact on health, and especially when large predatory fish are consumed. They have higher levels of mercury as a result of eating many smaller fish that have acquired mercury through ingestion of plankton. Now, exposure to methyl mercury mainly occurs through consumption of fish and shellfish contaminated with methyl mercury, and through worker inhalation of elemental mercury vapors during industrial processes. Among those exposed, the fetus is most susceptible to damage by methyl mercury. This can result from the mother's consumption of fish and shellfish. The baby's growing brain and nervous system are first affected. Brain, nervous system, yeah. Therefore, cognitive thinking and memory, attention, language, and fine motor and visual spatial skills may be affected in children who were exposed to methyl mercury as fetuses. The second group consists of people who are regularly exposed to high levels of mercury. So this is a sensitive population. These populations rely on subsistence fishing or are occupationally exposed. These populations include Brazil, Canada, China, Colombia, and Greenland. In Minamata, Japan, in the 1950s, the disease called Minamata Disease peaked, and severe cases were presented with brain damage, paralysis, incoherent speech, and delirium. It affected at least 50,000 people, and more than 2,000 cases of Minamata disease were certified. And this was from an industrial accident from a factory. Now, the inhalation of mercury vapor that is not from indirect exposure through dissolved and methylated mercury can produce harmful effects on the digestive system and immune system, lungs and kidneys, and may be fatal. Also, the inorganic salts of mercury, mercuric chloride, are corrosive to the skin, eyes, and GI tract, and may induce kidney toxicity if ingested. It was shown that workers exposed to elemental mercury vapors in the air for several years present with symptoms of tremors, insomnia, memory loss, neuromuscular effects, headaches, and cognitive or motor dysfunction. So, some effects of prenatal and postnatal exposure on neurodevelopment from the University of Rochester School of Medicine, published in JAMA in 1998. Just a short background is that inorganic mercury is commonly discharged into lakes, rivers, and oceans, and it's then converted to methyl mercury by microorganisms and bioaccumulated up the aquatic food chain. So concerns in the U.S. began in the 1970s when elevated concentrations were found in the fish of the Great Lakes. And there were massive health disasters in Minamata, Japan, and Iraq, where severe exposures at about 674 parts per million, which was significantly more than the tolerable intake by the World Health Organization. It was so in Minamata, Japan, and Iraq, where there were severe exposures. It was associated with microcephaly, which is the small brain seizures, mental retardation, cerebral palsy. So, in this study, The mothers reported eating an average of 12 marine fish meals per week. It included the population of 779 mother-child pairs from the Republic of Seychelles, off the coast of Africa in the Indian Ocean, where 85% of the population consumes fish daily. And measured maternal child hair total mercury levels were measured. They both had similar total mercury levels, about 6.5 per million parts per million, and it has been shown that total mercury in maternal hair during pregnancy correlates well with blood levels of methylmercury in the fetal brain. So their measures of hair mercury was very well correlated to the mercury in the fetal brain, which is important. The child's first mercury levels were tested at 66 months, or 5.5 years, and they did various measures, including the McCarthy Scale of Children's Abilities, which is a well-known measure of cognitive health, as well as some other tests for cognitive function. These tests are all sufficiently sensitive and accurate to detect neurotoxicity in the presence of a number of confounding factors, so it takes into account a lot of factors. The results they found were similar to what would be expected from a healthy, well-developing U.S. population. 4 of the 6 measures showed better scores in the highest methylmercury groups compared with lower groups for both prenatal and postnatal exposure. Now, what fish were they eating? Because that can be important for the study's relevance, right? They analyzed levels of mercury in the region's fish and found a range from 0.004 parts per million to 0.75 parts per million. These levels are comparable with the fish in the U.S. market. And at the end of this PowerPoint, I'll have a link to the FDA's table on the different fish and shellfish and their corresponding methylmercury levels, if you're interested. The study concluded that a diet high in ocean fish appears to pose no threat to developmental outcomes through 66 months of age. Then, in 1971, a Swedish expert group conducted the first extensive evaluation of human health risks from methylmercury in fish. They concluded the lowest toxic level to be 50 parts per million. And then when the World Health Organization reaffirmed the study, they took into account a significant portion of the population, and then they included a factor of 10 to make their upper tolerable level of 5. And this is found in hair samples specifically. In summary, the results of extensive performance tests conducted with children at 66 months of age strongly support the findings at younger ages. These researchers, as well as others cited in this article, other researchers, support the observation that it would be inadvisable to forego the health benefits of fish consumption to protect against a small risk of adverse effects at the level of methylmercury found in ocean fish on the U.S. market. It has been demonstrated in experimental animals that a high-fiber diet can accelerate the elimination of mercury from the body. This is from a critical review in toxicology. So, a recent report from a study of fish eaters in the Amazon basin indicated that individuals consuming fresh fish have much lower hair levels of methylmercury compared to those with the same daily intake of fish, but without the fresh fruit. Despite almost 30 years of studies searching for adverse effects in human health from ingestion of methylmercury in fish, no clear answer has yet emerged. So what is the Minamata Convention? This was hosted by the World Health Organization in so how do we reduce the human exposure from methyl mercury sources? The Minamata Convention on Mercury was working with government parties to take a range of actions, including to address mercury emissions and phasing out certain methyl-containing products. They want their second goal was to they had these 4 goals, and these were mainly to remove the people from exposure to methyl mercury. And then they also worked to promote the use of clean energy sources that do not burn coal and eliminate mercury mining and gold extraction and other industrial processes. They worked to phase out use of non-essential mercury-containing products and implement safe handling, use, and disposal of remaining mercury-containing products, including batteries, thermometers, certain electrical equipment, and cosmetics. Also, dental amalgam is used in almost all countries, which looks like this. A 2009 WHO expert consultation concluded that a global ban would be problematic for public health, but a phase down should be pursued by promoting disease. A phase out should be pursued by promoting disease prevention. Put a phase down. A 2009 WHO expert consultation concluded that a global ban would be problematic for public health. Mercury in the form of ethyl mercury is used in very small amounts as a preservative in vaccines and pharmaceuticals. However, this form is broken down quickly, and the World Health Organization has consistently reached the same conclusion that there's no evidence that this amount in vaccines poses a health risk. So what about screening for mercury levels in fish? I found this interesting article from the Journal of American Chemistry Society, where they used a selective fluorescent chemosensor. So concerns over toxic exposure to mercury provided motivation to explore new methods for monitoring aqueous mercury from biological and environmental samples. This molecule, as shown in this diagram, mercury fluor 1, is a water-soluble fluorescent chemosensor for screening mercury levels in fish. It is capable of reliably detecting mercury levels in fish over a range of 0.1 to 8 parts per million. The probe's range is ideal for assaying fish for safe human consumption, according to the guidelines suggested by the EPA. And the US FDA has a table with mercury concentrations by species, and the link is included in the references. Fun fact was that a canned tuna has about 0.3 parts per million of methyl mercury. So some advice about eating fish. According to Harvard medical school professors, in a review published in the Journal of the American Medical Association, we should still be eating fish. For major health outcomes among adults, based on both the strength of the evidence and the potential magnitudes of effect, the benefits of fish intake exceed the potential risks. For women of childbearing age, benefits of modest fish intake, except for a few selected species, also outweigh risks. It is recommended to have only 1 serving of the bigger fish, not the largest fish, and 2 to 3 servings a week of the smaller fish and shellfish. In addition, it is recommended that children should be given fish starting at age 2, and a serving is about the size of the palm. And these are all my references. Thank you for listening to my presentation.